so I have to look here instead of here. I'm just looking at myself. Boys, we are the boys emotion. We give you all the emotion. Boys, we are the boys emotion. We give you all devotion. We can do the beat inside. Show me what you're trying to hide. I can feel the rhythm of your heart. Excuse me. Alright. Polycystic ovarian syndrome, PCOS. Can we talk about it? Let's talk about it. Come here. For those of you who don't know me, my name is Wilshina. I'm here to share my story and how I got diagnosed with PCOS. You ready? Okay. Where to start? Where to begin? I don't know. Like, there's so much. Oh, shit. My stomach. So I was diagnosed with polycystic ovarian syndrome like about 5 years ago, but I think I started having symptoms like when I was in high school. So probably even before high school. I think it started when I was 12. First of all, let me tell you what polycystic ovarian syndrome is. I'm sure some of you maybe have heard the name but just still don't know what it is. So PCOS is a hormone imbalance. It's a collection of fluids and follicles in your ovaries that kind of block, or like it fails to release or regulate your eggs. This causes irregular periods for certain women, excess androgen levels, so you produce more male hormones than female hormones, causing hirsutism, so excessive facial hair or excessive hair in your body, acne, fatigue, depression, weight gain. That's a common issue. Diabetes, that's also a common issue. That's probably like the core of PCOS. A lot of women deal with either pre-diabetes or diabetes. It can also cause other issues and complications such as hidradenitis suppurativa, which is what I have, cardiovascular issues, sexual dysfunction. The list goes on. For me, how it all started, it started with hidradenitis suppurativa. Hidradenitis suppurativa is an oil gland inflammation. I would get these like cyst-like pimples either in my armpits or in my groin area. It got worse in high school. I started having them regularly, especially under my armpits. So my doctor examined it and he told me it was hidradenitis suppurativa and that it's related to PCOS. And I was like, what the heck is that? I also noticed that I was starting to get unwanted hair in my face. Naturally, I have like hairy sideburns. So I just thought that I was a hairy woman. But then it just started to get worse and worse, and people were noticing, and people were just looking at my face like I was some type of alien. What is that on her face? What the heck? Ooh, what is that on her face? So imagine dealing with that in high school. Honestly, took a toll on my self-esteem. Still does. I'm not even gonna lie with you. If it wasn't for the hidradenitis suppurativa, I don't think I would have known that I had PCOS. Only because I still get my periods every single month. My doctor gave me a blood requisition so I can go take some blood. I also did a pelvic ultrasound. This was like back in 2015. I did my ultrasound and I did my blood test. When I did my ultrasound, they didn't notice any cyst in my ovaries. So because of that, because I had my periods every month and because it didn't see any cyst in my ovaries, they didn't really declare it as PCOS. I think they just thought that I had like I don't know how to say it, adrenal, something like that. Because of that, I didn't think that I had PCOS. So like I just went about my life, going to school, going to work, going to church, doing whatever. So fast forward a few years later, just like after high school, you know, I'm not working out as much, I'm not eating that well, I'm not sleeping that well. So my symptoms would flare up. So I decided to go back to my doctor. I did some more blood tests. The results of my blood tests, my levels and everything, it just ruled out that I had PCOS. I got referred to an endocrinologist and a dermatologist for my hirsutism, but also my hidradenitis suppurativa because it's a skin related issue. Now, when I went to go see my dermatologist, she prescribed me this drug called doxycycline for my hidradenitis suppurativa, which is kind of like an antibacterial, like infection killer. The doxycycline that she prescribed me did not make me feel good at all. My stomach was just not having it. I think after a week or two of taking it, I puked out blood. I was just like, I'm not gonna take that anymore. So yeah, I stopped taking that. They did prescribe me like another topical gel that was stronger than what my family doctor recommended me. I don't remember if it was my endocrinologist or my family doctor, but I was prescribed birth control. Again, it just didn't make me feel good. So I stopped taking that too. When I saw my endocrinologist, she prescribed me metformin to help with to help me with something. She didn't tell me why I was supposed to take it, but I didn't do well on that one either. So I stopped. There's a pattern here. I was very inconsistent. As you can tell, I don't like taking drugs or synthetic hormones. It's just not for me. After I stopped taking the metformin, I was living my life, keeping myself busy, tried to ignore the fact that I had PCOS. Don't do that. That's not good. Don't do it. But then COVID happened. Oh Lord. So all my symptoms were like, it's COVID.
You can't go nowhere. You can't do nothing.
I actually started suffering a little bit before COVID. Oh my God. I had like this huge flare up. Hidradenitis suppurativa flare up. It came back during COVID and it was bad. I had to go to the emergency room. After that visit to the emergency room, the nurses that took care of me put me back on doxycycline and recommended that I should keep going to my endocrinologist and my dermatologist. You know. I had to go back to my doctor and be like, hey, I'm back. My doctor was like, you need to be more consistent. You need to set an appointment with your endocrinologist and your dermatologist and see them more frequently. And I was like, alright, fine. So that's what I did. Before doing that, I had to do a blood test to see what my blood sugar level was like. It turned out that I have pre-diabetes, right? So my blood sugar levels were higher than normal, but not to the point where I had diabetes. So because of that, I really have to make sure to stay on top of my appointments and my medication and stuff like that. This PCOS thing, it really takes a toll on your body. The fatigue is crazy. The depression is crazy. It hits you hard. It just affected every single area in my life, you know, spiritually, physically, mentally, as far as like what I want to do in my life. Like it just left me so like defeated. I think the frustrating thing about PCOS and being diagnosed with PCOS, sometimes I would go see my endocrinologist and I would leave there feeling so defeated. Like, yo, I'm even more confused than when I got in. Like, I don't know what to do. I don't know what to eat. These medications are not working for me. It's hard to explain PCOS when you yourself don't understand what PCOS is. It took me like 5 years to actually start understanding what it is that's going on in my body. Still to this day, I'm still trying to put every pieces together. Honestly, I just feel like doctors lack the information. I recently had an appointment with my endocrinologist over the phone because I've been following a bunch of women with PCOS and reading about this specific supplement called Ovasitol, which is like a supplement to help with your sugar levels. And it kind of, I don't want to say it works like metformin, but it has similar functions, if you can say. So I asked my endocrinologist about it and she basically shut me off. She's like, it's not part of the treatment plan. I'm gonna put you back on metformin. I'm gonna increase your dose, just diet and exercise. I'm still gonna try it though. Honestly, like it's worked for so many women, so I just feel like I might as well try it to see what it does for me. If it doesn't, then it doesn't. Nowadays, like you go to your doctors, they tell you what you have, they give you medication, and it's like, okay, bye, see you next week, or bye, see you next month. I had to kind of figure it out on my own. Going on the internet, social media, there's a lot of women with PCOS who deal with PCOS. And I've learned more from them than I have with my doctors. As far as figuring out what to eat, figuring out how to work out, figuring out how to keep myself, you know, sane. Like the scariest thing with PCOS is just like the idea of knowing that I'm at risk of infertility. It is not an infertility disease. Because of the name, people think like, oh, infertility issue, like blah, blah, blah. It is scary to think that I'm at risk of infertility, but I'm not gonna let that get over my head, right? If many women have been able to reverse the symptoms and have children and live a healthy, happy life with PCOS, I could do the same too. If you feel like you have it, or if you feel like you have these symptoms are related to PCOS, definitely recommend you go to your doctor. Like just asking questions, like be your own advocate and be like, listen, this is what's going on with my body. Can I please get a diagnosis? Because you may have it, but you just don't know it, right? Just like for me, if it wasn't for the hidradenitis suppurativa, I don't think I would have ever known that I had PCOS because my periods were regular. I can't tell if I have cysts in my ovaries, excessive hair. Like, I just thought that like I was a hairy woman. Not everybody is gonna assimilate facial hair or whatever with PCOS, you know what I mean? The goal of me making this video is to, one, to inform people about PCOS. 1 out of 10 women has PCOS, but many women go undiagnosed, only because their symptoms are not as visible or common as the regular symptoms, you know what I mean? I can put a list down below of some of the symptoms. Like, also, it's been a very confusing journey. You have so many people suggesting you what to eat, what not to eat, how to work out, how not to work out.
Just diet and exercise. Eat less calories to cut out shit. You should try the keto diet as long as you take your medicine. Work out harder. Just eat lettuce, girl. Lose weight. Just eat lettuce.
I'm just gonna take you guys with me on this journey. What I eat, how I work out, how many times do I work out. I'm just basically creating a plan that works for me, but obviously like helping you guys out as well. So my goal is not necessarily to lose weight, more so to regulate my hormones and kind of reverse my symptoms. I want to develop a better relationship with food. I want to develop a better relationship with physical activity, and I really want to document that and see where it's going to lead me. And I want to take you guys with me, if that's okay. All right, because I don't want to do it alone. And if I do it alone, it's okay, because I got Jesus with me. Okay? So stay tuned. Stay tuned for recipes. Stay tuned for vlogs. What I eat, what I do as workouts. I'm really excited for this. If you thought this video was informative, like, let me know. Like, make sure to like, comment, subscribe, message me on Instagram. Let's help each other out, yeah? Thank you for watching. Thank you for watching. Hopefully I didn't miss anything. I think I said what I wanted to say. We will be healed in the name of Jesus. Oh. Anywho, thank you for watching. I'll see you next time.